Good morning, ladies and gentlemen. My name is Hwang. I'm second-year internal medicine resident of Northside Medical Center. Before starting presentations, I'd like to express my deepest gratitude to Dr. Barlow, who had been a tremendous help in making this presentation possible. And I also feel deeply honored to be here to present the case at the Physician in Training Leadership Conference. Today, I'm going to present a very first and pioneering case of usage of Brentuximab Vedotin in a patients with peritoneal dialysis. Before starting presentation, I'd like to clarify that I do not have any financial affiliations or connections with any kind of company or group. So let's get to know our patients first. He is a 75-year-old male with a past medical history of end-stage renal disease. He is on peritoneal dialysis daily. Initially, he found out a skin lesion on the right flank area, and he thought that it might be a bug bite. However, the size of the lesion increased significantly, and the patients also found out another lesion at the left lower back area. Because all these findings, the patient decided to visit a dermatology clinic. At the first encounter, the patients reported that he did not have any fever, no chill, no night sweat, no weight loss, no history of any similar lesions before. And on physical examinations, we were able to find just two skin lesions, which was around like 6 centimeters erythematous skin lesion without ulceration, but there was no lymphadenopathy noticed. And other than that, the physical examination was quite unremarkable. However, with the concern of malignancy, the patient underwent biopsy on the right flank area, and these two photos there are the result of the biopsy, and you can see a dermal infiltration of cancer cell with the strong CD30 positivity. After that, the patient was referred to the oncology clinic, and the patient underwent further tests. Peripheral blood flow cytometry was negative for atypical cellular populations. PET-CT scan was only positive for 2 known skin lesions, meaning that these lesions were localized. With all these findings, the patient was diagnosed with primary cutaneous anaplastic large cell lymphoma. So, as the lesions were localized, the patient was planning on receiving radiation therapy. However, in between waiting for the treatment to be initiated, unfortunately, the patient developed multiple skin lesions on his body, making the radiation therapy as an unfeasible option. So the secondary treatment was considered, which was Brentuximab Vedotin, which was initially approved in 2011 for managing of relapsing Hodgkin lymphoma, but also now used in the treatment of this condition. The only problem was that this medication had not been used in the patient with the ESRD condition. So the patient underwent exhaustive discussion and decided to proceed with this medication. The patient started with the dose of 1.2 milligram per kg every 3 weeks. This dose is recommended by FDA for the patients with mild to moderate renal impairment. However, after 1 to 2 cycles, the patient started experiencing severe weakness. At the time, the patient also had the COVID-19 infections concurrently, so this might have contributed to patient's weakness. Anyhow, the dose was further decreased to 0.9 milligram per kg, and after that, the patient's weakness resolved, and he did not experience any kind of side effects. And he was able to finish all doses, 12 cycles in December 2023, and if you see the photos on the right area, you can see the skin lesions after the treatment. The photo on the right area is the skin lesion after the treatment. And if you compare the one on the left, you can see the complete resolution of the skin lesion. And follow-up PET-CT scan was negative for any further atypical uptake, indicating absence of malignancy. Importantly, the patient did not have any side effects, including fever, neutropenia, or peripheral weakness, and also the patient's kidney functions and electrolyte had been very stable throughout the cycle of treatment, as you can see in the graph. The orange dot indicates the patient's potassium function, and also the dark dot indicates the patient's creatinine function has been very stable throughout the cycle. So this case is the very first case of Brentuximab Vedotin being used in the patient with a peritoneal dialysis. So throughout this case, I want to talk about primary cutaneous T-cell lymphoma first. This is a non-Hodgkin lymphoma defined by the presence of malignant T-cell. It is further classified by mycosis fungoides, primary cutaneous anaplastic large cell lymphoma, as we discussed in this case, and also lymphomatoid papulosis. Commonly, it expresses strong CD30 positivity, and usually this disease is pretty indolent and has an excellent prognosis, but it can be progressive, as in this case, but sometimes it can be fatal. The treatment usually include radiation therapy, or it can be removed surgically. However, when it is unfeasible, like in this case, patients need to get chemotherapeutic agent or immunomodulatory treatment. And let's talk about Brentuximab Vedotin, which was the key theme of this case. So this medication was initially approved in 2011, as I mentioned. However, in 2021, it is also approved for the treatment of this condition. The mode of action is pretty interesting. This medication consists of anti-CD30 antibody and also microtubule disrupting agent called MMAE. When this medication binds with CD30 receptors of the cancer cell, it gets internalized and it gets degraded by the lysosome. Through that process, MMAE is getting released from this molecule and binds to the microtubule inside of the cancer cell, leading to the death of the cancer cell. The elimination of this drug usually removed by proteolytic degradation. However, the released MMAE is primarily dependent on the kidney and the liver. If you see the graph below, this graph shows the relationship between the mean MMAE serum concentration according to the patient's kidney functions. And you can see the serum concentration, the orange dot group has a really significantly elevated MMAE concentration. This orange group indicates the patients with severe renal impairment, creatinine clearance less than 30. So based on this information, FDA recommends avoiding the use of medication in patients with severe renal impairment. As of now, there are 3 case reports where this medication had been used in the patients with hemodialysis, but was able to induce a very successful treatment report, but it was never been used in the peritoneal dialysis. So this case has 2 significant clinical implications. One is this case report actually strengthened the possibility of this medication being used in the patient with ESRD. Secondly, in this case, the patient received 0.9 milligram per kg of Brentuximab Vedotin, which was further decreased than the FDA recommendations, meaning that the patient with ESRD patient can get a lower dose, but still has a full treatment efficacy. Of course, we need a further case report and clinical series to change the FDA recommendations, but this case shows a strong potential of this medication to be used in the patients with ESRD who has been excluded for consideration of this medication. This is the reference of this, and thank you very much.
Thank you so much. So do you have any specific questions?
I was just wondering if you thought that it was the dose reduction that allowed this to be done successfully, or that actually the drug itself is dialyzable.
So, so there was no report that this medication is able to be dialyzed, so I'm not sure about that information yet. But the dose was further decreased because of the patient's weakness, and it was still able to induce a really significant clinical efficacy. So we believe that this medication can still be used with that dose for ESRD patients, because that medication will be built up in the patient's body if the patient has a significant renal failure.
And then what other significant side effects should practitioners be aware of for the brentuximab therapy?
As I mentioned, usually the side effect includes fever. The patient usually experience peripheral neuropathy a lot. And also in severe case, it can cause neutropenia. So that's the things that physicians should be aware of.
All right. Well, thank you so much for that great
Very much.
presentation.